Rebecca Lundy, and today we'll be discussing the 3-year evaluation assessment results from 2016 for Jeff Johnson, a 12-year-old student medically diagnosed with autism spectrum disorder, entering his 8th grade year at Washington Junior High School. First, let's look at the developmental profiles and behavioral assessment. The Developmental Profile 3 was utilized to measure Jeff's development on 5 scales that are designed to assess the developmental functioning of children ages birth through 12. In the cognitive portion, Jeff scored less than 1% and had a descriptive category of delayed. The Woodcock-Johnson Test of Achievement, 4th edition, is an individually administered assessment used to measure the achievement in the subject areas of mathematics, reading, and written language. Scores of 90 to 110 are considered average. To obtain standard scores, Jeff's performance was compared with that of same-age peers. Jeff was able to read 1- and 2-syllable words and used decoding skills to correctly pronounce unfamiliar words. Jeff's strengths, according to the assessment, are in the areas of letter and word identification with a 2nd grade, 3rd semester grade equivalent, and number matrices, or the math portion, with a 2nd grade, 1st semester grade equivalent. His greatest area of need is in applied problems under the math section, with a less than kindergarten grade equivalent. Jeff also exhibits difficulty in math problem solving and passage comprehension with a 1st grade, 3rd semester grade equivalent. Now, the Adaptive Behavior Assessment Scale 2nd edition was used as a comprehensive assessment for individuals who have difficulties with the daily adaptive skills necessary to function effectively in their environments. This can be utilized for individuals from birth to age 89. The composite score of 40 on the parent form and 49 on the teacher form indicate that Jeff is functioning within the extremely low classification when compared to other students his age. His adaptive skills show some relative strength in the area of school living as compared to those of home living. The Social Skills Improvement System assessment was used to assess social behaviors that can affect the parent-to-child and the teacher-to-student relationships. It affects peer acceptance and academic performance. This assessment documents the perceived frequency and importance of behaviors that influence the student's development and adaptive functioning in the home, school, and community settings. Scores for the social skills, problem behaviors, and academic competence scales are reported as standard scores and percentiles. Standard scores are taken from the scores of a large, nationally representative sample of students of similar age and the same sex as Jeff. The standard scores, ranging from 85 to 115, fall within the average classification. Jeff's social skills scores is based on the teacher rating of 73, placing him in the below average range. His mother's score of 57 places him in the well below average range. In the area of problem behaviors, Jeff's teacher gave him a rating of 117, placing him in the area of average to above average for negative behaviors. His mother gave him a rating of 123, placing him in the above average range. For the academic competence scale score, the teacher gave him a rating of 89, placing him in the below average range. This assessment suggests that Jeff's adaptive social skills and academic competence skills are below average, and his problem behaviors are above average in the school and the home setting. Jeff's strengths include cooperation, responsibility, and self-control, as indicated by the teacher rating. His needs lie in the areas of communication, assertion, empathy, and engagement. For the problem behavior scale, Jeff was above average ratings in hyperactivity and inattention, and has difficulty making eye contact. An adaptive behavior plan was created for Jeff. It is designed by the IEP team specific to Jeff to provide guidelines for teaching positive replacement behaviors to take the place of disruptive behaviors. The purpose is to provide more intensive monitoring and intervention concerning the behavior. It increases support for the student and places individualized plans for success in place. According to the behavior plan, Jeff exhibits behaviors typical of a student with a diagnosis of autism spectrum disorder. He has difficulty in new settings and with new tasks. He is routine-oriented and struggles with remaining on task, specifically those that require independent work. Replacement behaviors are necessary to teach him positive time management skills and how to complete undesirable tasks. The behavior plan indicates success with the use of positive reinforcers in the form of a token system and allowing Jeff to request breaks prior to his tasks. During the speech assessments, the Oral and Written Language Scales, 2nd edition, Listening Comprehension and Oral Expression Scales, or OWLS 2, was used to assess Jeff's oral written language, listening comprehension, and oral expression skills. It is reported by the speech therapist that Jeff experienced profound difficulty with the OWLS 2 assessment. She admitted that a legitimate basal was obtained for listening comprehension and oral expression, but he did not have the receptive and expressive language skills to respond to the increasingly complex questions. The Pragmatic Language Skills Inventory was also administered to assess Jeff's pragmatic language skills in a checklist given to a teacher familiar with the student. It addresses 3 areas of classroom interaction, social interaction, and personal interaction. According to this assessment, Jeff has areas of concern in classroom and social interaction and severe needs in the area of personal interaction. This includes the skills necessary in the classroom for Jeff to be successful with participating in peer-directed routines, conversational skills, turn-taking, and recognizing when he is arguing. For personal interaction, Jeff has the greatest need. This entails skills such as expressing emotions appropriately, complimenting, asking favors, and participating in verbal exchanges. The purpose of the Children's Communication Checklist 2 is to identify children with pragmatic language impairments, children who may have a speech and language impairment, and whose receptive and expressive language skills should be further evaluated. When compared to his peers, Jeff shows significant difficulties with social use of language as compared to his same-age peers, with no percentile score going above 1%. His greatest area of needs are syntax, context, and nonverbal communication. His area of strength includes coherence and social relations. His greatest area of need is once again in the nonverbal communication context. Occupational therapy assessments were utilized, including the Visual Motor Integration 6th edition. This helped to judge the ability of Jeff to perceive and reproduce visual stimuli. A standard score of 90 to 109 is considered to be in the average range. 80 to 89 is below average, and 70 to 79 is in the low range. The visual motor skills expressed by Jeff are considered very low when compared to his same-age peers. These delays affect the ability to produce legible writing. Jeff could copy basic lines and shapes, but struggled with more complex structures. His age equivalent on this assessment is 5 years, 2 months, and is well below the age of the time of the assessment of 10 years, 5 months. The School Functional Assessment is a criterion reference test used to measure a student's performance of functional tasks in the academic and social aspects of a school setting for grades K through 12. The instrument is completed by one or more school professionals who know the student well. The results of this assessment indicate that Jeff requires assistance in many areas of daily activities. His strengths include setting up, cleaning up, and clothing management. His areas of greatest need lie in the cognitive and behavioral task criterion. This includes items such as maintaining attention, interacting positively, and personal care, such as hygiene and equipment use. His score of 59 for the special education classroom and 5 other settings indicates that he has difficulty generalizing skills across multiple settings. The Sensory Profile School Companion was used to measure sensory processing skills as related to classroom performance. The Sensory Profile is a 62-item questionnaire. The questionnaire is organized in sensory groups of auditory, visual, movement, touch, and behavior. Jeff's scores indicate significant delays in sensory processing skills, with 11 of the 13 scores falling in the definitive difference range. He has difficulty processing and modulating sensory input. The teacher reports he is easily distracted by noises, seeks all kind of movement. He is slower to participate in physical activities. He often enters another person's personal space, and he has shown signs of overreaction. These scores indicate that he overresponds to many sensory stimulations, with the exception of vision, where he scored in the typical performance range. He seeks sensory input, indicating this could be why Jeff seems to be in constant motion. Jeff's current classroom placement during the normal school year utilizes the LINKS curriculum in alignment with the district requirements. LINKS curriculum is the sister program to STAR Autism Support curriculum designed for older students grades 5 through 12. Jeff has successfully mastered all 5 areas of the LINKS Level 1 lessons and is ready to progress to Level 2. This level will assist in preparing Jeff for a more academically inclusive educational setting. He received 100% mastery in the areas of embedded lessons, responding to language, functional academics, and engaging in diverse activities. In the area of communication with others, he started the school year with a 35% and finished with 85%, a 50% increase. I concur with the assessment results and view them as largely consistent with the typical needs of a student of a medical diagnosis of autism spectrum disorder. Jeff exhibits a delay in cognitive development as indicated in the DP3, and specifically in the areas of mathematics, reading, and written language. His adaptive behavior skills are classified as extremely low, and his social skills are also well below average. These are all areas that students with ASD exhibit. When assessing visual and motor integration, the assessment indicates a need in the area of cognitive and behavioral tasks, which are also consistent with an ASD diagnosis. These assessment results are consistent with the performance that Jeff exhibits within the classroom. The sensory profile highlights the most obvious areas of need with significant delays in sensory processing skills. Due to the length of time since these assessments were conducted, there may be slight variations, with hope for an increase in performance when his next 3-year evaluation takes place.